So, welcome back. So this is the first panel session and plenary discussion around when is real-world data element fit for assessment of eligibility, treatment, exposure, or outcomes. So this is one of 4 sessions today where we're primarily looking at the sort of the decision framework, the draft decision framework that has been produced. You should be aware of it. It's in your pack that you received as an electronic pack, and it looks something like that. So there's a few pages of that. So essentially, you might want to bring that up to stimulate your thoughts on this. So in this session, the key objectives are to discuss the potential sources of bias, to look at what are the key considerations in the data collection and evidence generation around real-world data, and then discuss, as I said, the decision aid that has been produced to outline and discuss key questions and considerations that might help inform current and future study designs. So this is one of 4 sessions over the next 2 days. So the decision aids are intended to lay out key questions for stakeholders to consider early on, this is important, early on, how to make thoughtful choices around the development and design of rigorous but still manageable real-world evidence designs and real-world studies that all relevant parties, so that's the regulators, payers, patients and so on, and clinicians, agree in advance, if possible, that will generate the best and most reliable results. So that's the whole purpose of this. So 4 different sort of decision aids. The first one that we'll be focusing on in this session is when a particular real-world data element is fit for access, study, eligibility, treatment exposures, or outcomes. So some of the questions that are included in this, so this is really a twofold process, if you like. I haven't got a slide to show it to you, but it is in your pack. So on one hand, there's one stream that looks at the sort of questions you might want to ask yourselves if you're generating data within the clinical setting. On the other hand, there are slightly different questions when you're looking at what questions you might want to ask yourself if you're not in a clinical setting, so outside of the clinical settings. And as I say, the questions vary a bit, and the whole purpose of the panel this morning is to sort of provide a brief reflection from the panelists around the suitability of this, and then discuss whether the questions are fit for purpose or whether anything needs changing. Because as I say, this is still a draft proposal. So personally, just based on my sort of previous very brief introduction, I'm very much in favour of this sort of concept. The flow of questions is really logical and takes you through the relevant aspects that you need to consider. And an important bit to me is this is a prospective sort of directive element that allows people to create the appropriate study designs before the studies are implemented, and you're taking into account all the relevant aspects in that consideration. But at the same time, the questions are open enough, they're not particularly specific, so they're open enough not to be stifling, but they have an opportunity to produce a more specific question set on a specific data source if required. So, without further ado, I'm going to introduce the speakers and the panelists. So first of all, we have Jeff Allen. Jeff is President and Chief Executive Officer of Friends of Cancer Research. Then we have Lynn Altan. So Lynn is Senior Vice President of Research, Optim Labs. And then we have Robert Ball. Robert Ball is Deputy Director, Office of Surveillance and Epidemiology, Centre for Drug Evaluation and Research, FDA. We then have Luca Fascini, who is co-founder and chief data scientist, Evidation Health. And finally, and not least, Brandy Yeast, senior director, global patient outcomes and real-world evidence, Eli Lilly.